Everyone, I'm going to go through this again. I did a whole video. If you didn't watch the other video, you probably watched the other video. But if you didn't watch the other video, 10,947 Canadians died from COVID-19 up to November 15th. And 10,781 of them were in long-term care homes. Were those people shopping? Were those people out communicating? Were those people in the wider community spreading this disease? No, they weren't. And so this goes through it. Gives the source. I've done all that. If you want to see it, it's from CTV News National. This is the number of Canadians who died. This is the number of Canadians who were in long-term care homes, Quebec and Ontario. It seems to me we could have done better. It seems to me we could have probably made a bigger impact, right? If you take away 3,329 from 3,505, you get 176. But that doesn't take into account the roughly 9 days that or after this, so those may be long-term care deaths as well in there. So to me, it seems really a bridge too far to ask us to believe that we need to shut down the entire economy, that we need to shut down Manitoba, as most of the deaths were in Ontario and Quebec, right? They're not dying in Manitoba, yet Manitoba's got restrictions on essential items only for sale. This is not about a virus. This is not about numbers. I've seen, well, I'm going to get into it. I'm going to show you. I've seen people getting ticketed in St. John's for not wearing a mask outside. I've seen all sorts of crazy stuff. I've heard stories of people in Guelph being escorted out of the Canadian Tire for not wearing masks, despite the fact that written into the Section 22 order is a clear exemption. And the exemption cites the Ontario Human Rights Code. How come Canadian Tire, how come Costco can supersede the Ontario Human Rights Code? Because we have to litigate it? Just because a bully punches you doesn't make it your fault. Okay, back to this. StatsCan offers more on COVID-19 comorbidities, my new column. I went through this in my other video too. I don't think I'm going to rehash this. But essentially, maybe I didn't read it. I'm going to go through it. Here we go. A new Statistics Canada report sheds light on national comorbidity numbers for the COVID-19 deaths that occurred during the first wave, the most detailed release of its kind to date. Right. Okay. So I did go through this. Of the over 9,500 COVID-involved deaths between March and July, the majority of them had at least one other cause, condition, or complication reported on the certificate, explains the report. Now, again, this ties back, this bends right back onto the number of people who died or who were infected or the numbers from the long-term care homes. A lot of these numbers are overlapping with those numbers. And it turns out a whole bunch of them didn't actually die of COVID-19. So this is an interesting article if you want to share it around. Interestingly done. CBC in British Columbia is reporting BC flu cases exceptionally low this year. Exceptionally low this year. Lock everything down. I wonder if that could have anything to do with it. I wonder if that's why it's exceptionally low. But you people aren't doing enough, so we've got to lock down businesses. But not Costco, and not Canadian Tire, and not any of the other places, Walmart, that are, making this giant boon. Just your mom and pop shops. Just them. And we'll send the enforcement officers there too, because they don't have big lawyers and lobbyists. This is completely messed up. Okay, Winston Smith says, nothing to see here. It's just orders of magnitude difference between positive flu cases between this year and last year. Yeah, yep. Red is 2020 and pink is 2019, and we don't have any flu. There's no flu. And in 2019, there's flu. It's, suspect. It's suspect. I've got my suspect pants on. Okay, Millhouse is saying questions to address before locking down. And it's too late. We're in lockdown. People are in lockdown right now. There's businesses in Toronto and York that aren't allowed to operate. Walmart's fine. Costco's fine. Canadian Tire, no problems. Fine. They're problem. They've got no problems because they've got money and lobbyists, right? John Tory loves those guys. But he's going to crack down on small businesses, small restaurants, even though they don't have the data to back it up. They've got the framework. The framework says we have to close you. And so you're closed. I'm sorry. It's the clock on the wall. The clock says 8 o'clock. I can't do anything about that. It's bedtime. The framework says you close, so you close. We don't have to prove it. The framework says. Garbage framework. Toss it out. Anyway, questions to address before locking down. How do 2020 all-cause deaths compare to previous years? They're a little low, to be honest. They're a little low in Ontario, and I believe I did Canada, but I looked at Ontario certainly. And compared to the last few years, we're a little low. Number two, what's our max hospital capacity? I've done the research on this as well. Despite the fact that the news says we can have 150 people in long-term care without shutting down, or excuse me, not long-term care, in intensive care or critical care beds. In April, that was said in, November 18th or something like that, 19th. Oh, we've got 150 in critical care or intensive care, and so we have to shut down the surgeries, etc. It's a bottleneck point, says the news. But in April, we had 1,500 beds. Don't worry. Don't worry. We've got enough beds. We've got enough staff. We've got 63 billion pumping into this, and we've got 150 intensive care beds that we can bed now. We've got like 400 hospitals. You got one bed for the hospital in each part of the country? What are you doing? What are you doing? What kind of failed leadership is this? Honestly, what's our max hospital capacity? Back to this, number 3. How do current all-cause hospitalizations compare to capacity and to hospitalizations in the same period in each of the past 5 years? Let's stop modeling and let's start comparing to what's happened. In the past 5 years, we've run at 110 capacity in most hospitals and been able to keep staffing at okay levels, I suppose, because they've been able to provide the care. They've been able to run the hospitals, and we didn't have to shut down the whole rest of society, thereby destroying our culture and our economy. Because it's not just about the economy, it's also about our culture. They are destroying it, and they're doing it on purpose. Millhouse says, if you can't make a convincing argument for lockdown by answering these questions and backing it up with solid data, then sit down and shut up about lockdowns. Please, God. Okay, hold on. I've got my tabs going here. Here's Brian Lilly. He says, unfair, confusing restrictions clobber small businesses. Imagine the confusion of being a small retail in Toronto, Mississauga, or Brampton on Monday morning. You've been told for years that as a small business, you are the backbone of the economy, yet suddenly you're closed. The Costco and Walmart down the street are open, though, selling not only groceries, but everything else on their shelves. Heck, even the Bay downtown opened up, claiming they were selling essential products like the little food section that they have in the basement. But you are closed by provincial order. Premier Doug Ford says he didn't want to close your business, but he had to because it's necessary to stop COVID-19. See my earlier video and the earlier part of this video. It is not necessary. The long-term care people are not out dancing. They're not out at clubs. They're not yahoos, and they're not 30 or 35 years old. They are plus 80 and already very sick. This is honestly, there is no need for this, Doug Ford. And people see it. People see it. It's not just me who sees this. Back to this. And suddenly all the reporters who have been badgering Ford to shut down Toronto or even the whole province for weeks, if not months, are demanding to know why the province has forced these poor small businesses to close. It's confusing to say the least. Now add the pleadings of Prime Minister Justin Trudeau, who has urged people to stay home, not to go out unless they have to, and to only see family members. Then you hear the international flights keep piling up at Pearson Airport. On Monday morning, as the lockdown went into effect, there were flights from Copenhagen, Port of Spain, Sao Paulo, Miami, New Delhi, and Seoul, all before 9 a.m. Later in the day, there were flights from New York City, Dublin, London, Zurich, Frankfurt, and Tokyo. How's any of that fair? It's not. We've never received adequate response to the claim that the border is closed when it's clearly not, or why anyone can fly into Canada while I'm told to not visit friends and relatives across town. As for the strange retail orders, well, we've got some answers on Monday, but not all of them are satisfactory. No, the Bay can't open their doors to customers, and neither can IKEA under the claim that their frozen meatballs qualify them as frozen as a grocery store. As for allowing stores like Costco and Walmart to stay open, selling everything on their shelves because they also sell groceries, Premier Ford said that isn't going to change. It's not fair, Ford admitted before explaining why he won't follow Manitoba's route of have the stores allowed to stay open only sell from a list of items deemed essential. After speaking to some of the big box stores, it'd be a logistical nightmare, said Ford. They have essential items spread out throughout their whole store, and on top of that, how do they monitor and restrict people from going in there? This seems to me like the first salvo of a little political pantomime dance, because there's people calling for fairness, and so fairness means limiting the big box stores who are still allowed to open. Fairness would actually be just allowing the little guys to open and not limiting the big guys to only selling essential items. No, we definitely have to have all the stores closed except these big box stores. Yeah, definitely. And you can't open. Nope. You can't keep yourselves safe. Only the big box stores can keep other people safe. Morons. Honestly. Brian Whaley says, I talked about this in my other video as well. A Toronto restaurant will defy the law and open to indoor dining today. Will you go and face the prospect of a ticket? The food from Adamson Barbecue is amazing, but would you fight? The Sun's Joe Warmington has the story. Read, retweet, and recomment. I said that they're going to lose in my other video. I hope they don't. I hope they don't lose. I hope they take the ticket. I hope they burn the ticket. I hope a whole bunch of other restaurants on the street open up and do exactly the same thing. And I hope they all follow the same civil disobedience path. And I hope they have a restaurant. I hope they have a lawyer to litigate their case. Because this is the only way we're gonna win. It doesn't seem to matter. It doesn't seem to matter that a large majority of the deaths, less 176, and 176 isn't even the right number because this is 10 days old data. So less 176-ish, and we're told that we have to lock down for your safety. or you're going to get fines. Hold on, here it is. Federal ethics violators wind up with a $200 fine. Slap on the wrist. But if you open your small business, it's $5,000 per day. They'll just walk in and say, boom, here's your tickets. Here's your ticket, $5,000 per day. And I'm sure if they want to fight, then the city will be like, oh yeah, definitely, it'll be 10,000 a day or 12,000, or you can issue multiple tickets. They'll change what a day looks like, 12-hour period, 5-hour period, whatever. As long as people should be open, breakfast, that's a day, afternoon, that's a day. They will figure out ways to ratchet up the fines if they find the fines are working. So, I mean, I hope they don't lose. It's a big incentive to not open. You have to open. You have to open. Otherwise, what are we going to do? What are we going to do? You're just going to sit and go bankrupt? Why? On the province's say so? We're going to care for you, citizen? It's not enough. Here's Lucas Myers. So Hudson Bay on Queen Street told us that they were completely open because they're considered essential. We asked the premier about it, who passed it to Associate CMOH. Then we heard from the government that the bay should not be open, and they're looking into it. Should not be open for in-store, that is. Obviously, curbside pickup and delivery is permitted, right? Like, I mean, yes, the government knows better. You can do that and it's safe. Come on. How do they know that? Where's the data that backs that up? Honestly, ridiculous. And there's more tweets here, but he's talking about that. Glad I'm not playing a drinking game that involves taking a shot every time. Prab Sakrita says, and I'm sorry, I've got that terribly wrong, says unprecedented times, I'd be in bad shape. He's facing questions on why Ontario has closed small retailers to customers while big box retailers can sell anything. I said yesterday that I think they're positioning to force the big guys to sell from an essential list. I still think they're positioning. I think they're dancing. They're trying to get permission from the public. They're trying to have the conversation, begging them. It's a de facto. What are those things called? Hold on. Referendum. As soon as I hit pause, it came into my head. Referendum. It's a de facto referendum. They can point to Twitter. Or they can point to likes on Facebook and say, "Oh, see all the support we're getting." It's bullshit. Bullshit. Bot farms can do all that kind of stuff. But this is a public dance trying to figure out if the people of Ontario will tolerate it. And man, there's a lot of people who are begging for more lockdowns, begging for bigger restrictions. If you're scared, stay home. Nobody's stopping you. Cynthia Mulligan, and she is a reporter, journalist, political junkie, City News Toronto. She says big retailers in Manitoba have to close off non-essential items. Why didn't Ontario level the playing field to help small stores stay open so they can compete against big box stores? Ford has asked. It's not fair, he says, but it would be a logistical nightmare to make big box stores close areas. I think that it's funny that he doesn't go the other way and look for a way to open the small retailers. He's condemning them to be bankrupt. That's it. Death of a business. Done. You're done. Sorry about your luck. You don't get Christmas this year. You don't get Easter. You don't get summer. You don't get go back to school, and you don't get Christmas. You don't have a business. You got bills. That's it. Mike Schreiner from Guelph. Mike, keep your nose out of it, man. It's from Toronto. And he says it's not fair that Costco and Walmart can keep selling jewelry and PlayStations while small retailers must shut down their stores. We need a level playing field. The province should consider restricting big box stores to the sale of essential goods only. Communist. You communist. Ridiculous. He's Prabhat Sakaria. Sorry, I forgot that wrong. He's an MPP for Brampton South. He's in Ford's cabinet. And he says that we have invested $57 million in the Digital Main Street program to help small businesses get online and expand their e-commerce. Apply for the $2,500 grant by clicking the link below. Okay, things that you need to understand about getting online. And I responded. I'm in Twitter jail today as well. I don't know what I did. I keep trying to start the timer and it says the server responded, or the server understood, but can't start the timer for whatever reason. Doesn't matter. But I said, you idiots don't understand how to do business online. Here's $2,500. Build a website and boom, you're online. Except that's not how it works. SEO updates, monthly updates, whatever cost per item sold. If you're working on Shopify, you don't have to worry about the updates then. But the cost per item sold is expensive, right? There's no other way to put it. Much more. How do you get traffic to these new sites? So if you're a brand new, say you're a downtown kit shop, right? If you're a downtown shop and you've got regular stock coming in from China, or wherever you've got your manufacturers or your suppliers, your wholesaler, whatever, they're getting supply from China generally because that's where supply comes from. So you're pulling in this stock and then you put it online, and it's more expensive to host this online. Basically, a storefront online is the same as a brick and mortar storefront. You have to pay rent on it, right? Whether that's through Shopify's per item sold, or if it's on maintaining a developer team and making sure that the website is working, et cetera, et cetera. And like that all costs money. That's complicated. And that doesn't even get traffic to the site. That just puts the thing up, right? And you all know, like if you go to a website that the people don't know what they're doing with e-commerce, you can see it, right? Like you can see it. It's like, oh, it's kind of clumsy or slow or whatever it is. Like there's all sorts of red flags. And I mean, like you can still buy from these things. Shopify has sites that are like, it's like cookie cutter, right? It's like it all looks the same and here's the wares and all that stuff. And sure, it's easy, but it's not a replacement for getting them back to business. And these people are behaving like it's the new coming of like, it's like sliced bread. Like we've solved the problem of shopping and you can just put it online. They don't understand that they've got rent to pay. And then paying double for housing their stock in the store and then also putting it online costs money again. And then shipping, delivery, all of that stuff comes into it. It's just, they're just lost. They're just lost. Atlantic bubble burst. St. John's $292 ticket for not wearing a mask outside in public. Armed guards sent to businesses to intimidate owners to enforce government mandates. Kids forced to wear masks all day, including outside. Total hospitalizations in New Brunswick? None. Same as in Guelph. We've got none in the hospital right now. Here's a Georgetown girl. Sorry, I've got that wrong. My brother-in-law just got banned for 10 years from Shoppers Drug Mart for not wearing a mask. Unbelievable. 95% recovery rate, 75% of wages covered for business is nice, but when your revenue is zero, you're still effed. Yeah, that's kind of generally it. Like, the government can help, but if you've got bills, you don't have a business. Right? Professor of pediatrics at the This is a doctor, and she is calling for lockdown. I'm trying to pause it. Anyway, she's calling for total lockdown. She says that's the only way to get a handle on this in Manitoba is to total lockdown. Total lockdown, total lockdown. See the beginning of this video and my other video for why they're lying, because they're lying. They're lying. They're lying. Long-term care, they're basically locked down anyway. They're not out shopping. Why are you locking things down? Liars. With the doctor claiming that lockdowns are the only way to stop the spread of COVID-19 in long-term care homes, I suppose. Legal action is vowed if Calgary put into COVID-19 lockdown. The Justice Center, a nonprofit, nonpartisan, non-political public interest law firm, made the vow after Calgary Emergency Management Chief Tom Stampton mused a 28-day circuit breaker may be needed. Who said 28 days? Does anybody have any links to this 28-day length? Is this the just amount of time that people will tolerate before they say, what the heck? Because no, it was before it was 14 days and now it's 28. Give me some data. Give me some reasons why it's 28. Any official sources, anybody? Please put it in the comments if you can find it. Article complaining about misinformation uses its own misinformation. Article says Alberta has only 173 ICU beds when on Thursday, November 12th, Alberta Premier Kenney in a live question and answer said the number of ICU beds available was around 650. They're lying. They're limiting our capacity. They're spending billions of dollars. Tens of billions of dollars, $63 billion on healthcare in Ontario, and they're saying that we can't possibly care for the people sick, the sick people, despite the fact that the hospital rates are 85% because they have to be in order to continue surgeries, and them claiming that one or zero people in hospital is overwhelming the hospital system, the healthcare system. This is lying. They're just lying. They're liars. They're not telling people the truth. And like, I don't know, there's no way to kind of like cloak and dagger wink that. Like, you have to plainly say it. They are lying. They are lying and they're ignoring data that this is not nearly as serious as they are claiming it is while they lock us down and destroy our culture. And so, I mean, I don't know what to do other than speak truth. Like the whole point of this was for me to speak truth about what I see happening in Canada. And I mean, like, yeah, they're lying liars. Lying effing liars. Okay, Newfoundland and PEI impose new travel restrictions, bursting the Atlantic bubble. So everywhere, despite the fact that the vast majority of deaths in Canada are in Ontario and Quebec, and the vast majority of those deaths are limited to long-term care facilities. This is all happening.
When there is a vaccine, are you going to require all of your passengers?
Stuff. Right? Qantas CEO Alan Joyce says proof of COVID-19 vaccination will be a condition of international travel. What in the world? This is a virus that has a 99% plus survival rate. This is a flu, and they're saying in order to travel on Qantas, you're going to have a vaccination. And spoiler alert, guys, what happens in Australia has been coming to Canada pretty quickly lately, right? Terrifyingly quickly, because now we're all in a lockdown situation where with these color-coded frameworks that are supposed to manage businesses and all the other stuff. But we've got Prime Minister Justin Trudeau saying, don't leave your house unless you absolutely have to. And it's kind of implied that a full lockdown is on, despite the fact that it's not in a lot of places in Ontario as well, right? Like there's places in Ontario that are green or yellow or orange. And despite the fact that they're green or yellow or orange, they're instituting these lockdown measures as well. I was driving down the street the other day in Guelph, and there was a lineup to get into Shoppers Drug Mart because they'd limited the number of people who can get in there. How is that better? It's cold outside, you morons. Very frustrating. It's very, very frustrating. And, you know, like telling you what I see, truthfully, I almost felt like getting out of my car and having my phone out and just going and talking to them and saying, like, do you think that this is helping at all? Do you think it's helping at all? I don't like doing like a Crowder thing where you just go up and talk to people, because there have got to be other people who think this is crazy. And I know that there are some people who think that this is all nuts. And I've heard from people one-on-one. I'd love to talk to people out in the public. Maybe I will do that. It's cold though. But there are big lineups of lots of people, aren't there? This could be fun. I might do this. Okay. Winston Smith said, if the politicians creating the ridiculous COVID laws and restrictions don't follow them, what does that tell you about what they really think of them? Windsor mayor breaks COVID restrictions at restaurant just hours after implementing them. Yeah, right. Look at that. Hey, everybody cheers, right? COVID, what COVID? We're sitting down and we're drinking and we're eating. Masks don't work. Masks don't work. Sorry, they don't work. Here is CBC News. Negative hostile comments against public health staff growing, says Dr. Wang. Good. They should stop lying. They don't have carte blanche to put illegal laws in place, especially considering what we know of the makeup of the deaths and long-term care and the location. This is incredibly inappropriate to have all of our freedoms and our culture and our businesses destroyed based on this. Really, for real. This is not a drill. This is not a joke. This is as serious as it gets. Colin DeMello says the government does not get unanimous consent to extend the term of Ontario's Chief Medical Officer of Health, Dr. David Williams. This means the government will have to go through debate and a vote before extending his contract. This government is inept. The leadership is in place because of Dominion voting software. Somebody built Dominion. You don't build Dominion to not use it. So why aren't the opposition bringing this up? Nobody in municipal, no high-placed MPPs are talking about the fact that Dominion did the placement of the CPC or the LPC or the OPC leaders. This is problematic, right? So anyway, Dr. Williams, has he done a good job? No. What do you think that we should do, Dr. Williams? I think we should lock down Toronto. Bad job. Bad choice. Is this serious, Dr. Williams? Yes, it's absolutely very serious. Oh, except that here's the long-term care deaths, and that's a vast majority of them. I think he's done an awful job. An awful, awful, awful job. So should they have a debate? Sure. Do I think it'll go anywhere? No. I don't think it'll go anywhere. They'll talk about how great he is and blah, blah, blah. And maybe one or two people will try and hold Doug Ford accountable and will kick him out of caucus. Ridiculous. Katie Telford. Modern day Joseph Goebbels, right? She's got the Ministry of Truth at her fingertips. She'll just get some op-eds written, right? Here she is. When Poilievre pumps up the Great Reset theory, he knows exactly what he's doing. He's sending messages to those way over on the far right who traffic in hateful, baseless theories about government conspiracies. Baseless theories? Here's Justin Trudeau talking about the Great Reset.
This pandemic has provided an opportunity for a reset. This is our chance to accelerate.
You far-right conspiracy theorists, you. Right? I mean, like, it is, don't believe your lying eyes. Don't believe your lying ears. Don't believe this video of Justin Trudeau talking about using the pandemic as an opportunity to reset everything while they destroy our culture and our small businesses, while the vast majority of the breathless reporting on deaths has been just about long-term care, right? My goodness. Breathless reporting, right? Feverish reporting. The deaths are increasing. We haven't had a death in Guelph since July, midsummer. You know, it's one of those things that they're lying. They're lying. Liberals will deliver fall fiscal update on November 30th, says Freeland. Spoiler alert, it's not going to be it's supposed to be a mini budget. They're calling it a mini budget, which is not a budget. Like when you start making up terms like that, it's not the thing that they're saying, right? Like equity for equality. It's not the thing that they're pretending that it is. So do I think this mini budget will give us any indication? They're saying that the The debt has increased since the summer. Shocking. Yeah, because they've locked down the businesses and they've needed to come up with a universal basic income. They're just going to run us into the ground. They are bankrupting us, and they're doing it on purpose. Goldstein says, Trudeau is a globalist who supports the Great Reset. That far-right conspiracy theorist, right? Yeah, here's the 98% plus of the deaths in this country are in long-term care homes and in Ontario and Quebec. And we're going to ruin everyone's lives instead of just protecting. Like, we could have had a strategy that dealt with this. We could have medicated. We could have done a whole bunch of things. And instead, they're using it to destroy our economy, destroy our small businesses, destroy our culture. That's what they're doing. They are making this choice. This is not an accident. Holly Doan says, ex-Liberal MP Frank Baylis summoned to testify at Commons Ethics Committee. His company, Baylis Medical, in the past year received 2 federal contracts, including $273 million for ventilators. I believe the ventilators were also not approved for use in Canada or anywhere. So, yay. And here's the CBC radio. Never mind the deficit. There's a group, and they deserve radio time, apparently. Canada is spending tremendous amounts of money to get the country through COVID-19 pandemic, but a growing movement says we can shed our old worries about the federal deficit. Don't worry about the deficit or the debt. Modern monetary theory argues that since we control our own currency, the currency can create more money and never go broke. Yeah, somebody who maybe understands finance should maybe weigh in here. This is an interesting press conference. It's 15 minutes long. I saw it yesterday. I think I was 12 minutes in and I got called away and I haven't finished it off yet. But they talk about, this is a briefing from CSIS or people who are doing a review of the potential infiltration of the Chinese Communist Party and foreign interests, foreign attacks, all of that kind of stuff. Well worth your time to watch it if you have some time to watch it. I don't think that I could give it a cogent, like too long didn't read, except that the things that they're uncovering with regards, I can. The things that they're uncovering with regards to the concerns about foreign interference in Canada and in every level of government should not be understated, but they're underreported. They're hard to understand. It's not easy to follow the bouncing ball. It's not easy to spend 15 minutes listening to kind of a dry interview. It's worth it, though, to understand what's going on. But fundamentally, I mean, the news is more interested in talking about racism and COVID-19 numbers than they are in talking about the Dominion numbers or the potential impact of having all of the party leaders in the most populous province, plus the federal leaders, plus provinces, plus municipalities using Dominion voting system in light of what's happening in the United States. Nobody's talked about that. Why? Where's the big opinion? Where's the big piece? Where are opinion pieces on this? Where does everybody have to pretend that the Justin Trudeau and his cabinet congratulating Biden is somehow a good thing, and that we're all just going to pretend that the Dominion vote flipping didn't happen? Because it really did. We could see it on TV. There's lots of evidence of it. Maybe it'll take Trump and his legal team making some kind of inroads into the in the legal system in the United States. Maybe it'll take the Supreme Court weighing in. I still haven't changed much. I saw Trump's tweet yesterday on moving into the last bit of our show. I saw Trump's tweet yesterday on the transition team giving Biden an office and beginning the transition, that Trump's authorizes people to begin that process. I have to say, I'm still not worried. Like, all of this stuff has legal markers that it has to go through, and I don't think that the Supreme Court's just going to let Biden assume office. I don't think that the House or the Senate, I don't think that they're just going to allow all of these states to be brushed under the rug. They might try, and every time I see like Biden closer to winning with this thing in this state or this thing in this state, I think to myself, the news has already declared Biden the winner. They keep redeclaring him the winner, so I mean they can do that as much as they want. So until like the courts have weighed in on this, and I mean the Supreme Courts in each state, and then bringing it up to the Supreme Court in the land, right, the U.S. Supreme Court, I think is necessary. So when if January 20th gets here and Biden's inaugurated, that'll be a problem. That'll be a problem, I think, for a lot of the world, even considering who's in his cabinet, right? But at this point, I still don't think that we need to worry about that. But hey, man, I could be wrong. It's a war. I have no idea. I'm just speculating on foreign election outcomes. And I mean, the impact will have an impact in Canada. And if Biden wins, they will sweep the Dominion under the rug. Nobody's going to be held accountable for that, and they will continue to steal elections with impunity, and they'll be less careful about it. Well, it'll be openly corrupt, like more openly corrupt than it is now. But if Biden isn't inaugurated and maybe even held accountable, can you sweep under the rug? I said yesterday, like, it's not a joke, like Biden's not going to be like, oh man, yeah, I guess those ones were installed by us because we have that software. I got, oops, I'm just going to go to the golf course. You guys have fun with the country. We'll see you in 4 years. That's not how this works, right? Like, treason's a big deal, right? So if Biden gets off without being prosecuted, or if the Biden mechanism, if Biden was completely insulated and didn't know anything, and I mean, maybe, who knows, right? He was quite senile from what I saw, but also I've seen him on point, right? He didn't do terribly with the debate with Trump. So, who knows? Who knows what's going to happen? I certainly don't, but there are a couple ways it could go. If Biden's inaugurated, not so good. If Trump's inaugurated, it'd be interesting. I don't know what happens if Trump's inaugurated and Biden's held accountable, because then other places will be like, hey, yeah, our votes were also messed with. But if Biden's not held accountable, then, well, we've got more of the same, right? We've got more people like this saying we're very concerned, but we can't get into how concerned we are. And then he gets replaced with another person, and then, has an unfortunate run-in with some heavyweights while he's alone weightlifting in a gym that he never goes to. Who knows, right? Who knows if he's very concerned? Who knows? Anyway, that's enough out of me. Thanks for watching, everybody. Check out CanadaPoly.com. Check out CanadaReport.co. Check out SpeakingMoistly.co. And have a wonderful, wonderful day.